So what I'd like to do right now is, and I know I've been kind of droning on for a while about shoulder replacement and shoulder replacement surgery, is I'd like to introduce you to a patient of mine named Chip, who had a shoulder replacement with me in March of 2011. Jennifer, would you mind turning on the lights for us? So the reason I asked Chip to come and speak with you tonight, because I can show all these slides, but I really think that what makes a difference to you is hey, what does it actually mean to a person, what we've done and what we've been able to accomplish. So Chip, you had a few words prepared. Thank you very much for being here.
Happy to be here with a good shoulder. This is the operative shoulder. I can do this, I can do this. In fact, my non-surgical shoulder at this point isn't as good as my surgical shoulder. And that's because during the recovering process, I had to rely more on my left shoulder and left hand to get things done. And I'm right-handed, by the way. So it took some time to get this one strong and even it out. But today, this shoulder, my new shoulder, is actually stronger than my left shoulder. I have to take it easy on my non-surgical shoulder. What I'd like to go back, though, is beyond the mechanics. How do you go through a decision-making process about having this kind of treatment, this kind of surgery? It sounds a little bit exotic. We do know about hip and knee replacements, but shoulder is kind of mysterious. And in a way, that's kind of unfair because our bodies ask more of our shoulders than any other joint. We lean on them to get out of bed, to get up out of a chair, to drive a car. Almost any task you can imagine that doesn't involve walking, and even walking in a balanced way with proper posture, puts some demand on the shoulder. I was in a situation where 20 years ago I had rotator cuff surgery. I had an overzealous personal trainer at a gym who wanted me to lift barbells behind my head, which today is not viewed as a good practice. The tendons became inflamed and I had an operation, and they warned me that maybe in about 20 years I'd develop some arthritis in this shoulder, and they were right. But after that surgery, I had physical therapy with someone who I have repeated it several times over the last 15 years or so. And in fact, before I decided to go ahead with this surgery, I went through probably about 8 weeks, maybe 12 weeks of physical therapy, just so we could see if that and a combination of cortisone injections could lead to a tolerable result. The cortisone injection basically gives your shoulder a reprieve so that you can do the physical therapy that might obviate the need for the surgery, might with a very small m. So it turned out that despite our best efforts with the physical therapy, surgery was really necessary. But the reason I bring up the therapy before the surgery is that if you can develop a good rapport with your physical therapist before you decide to have the surgery, that therapist is ideal to help you recover from the surgery. Why? Because she knows you, in my case. She knows your limits. She knows when you're whining and kind of being grouchy versus how far you can push things and how quickly you can go. So I went into this decision knowing that after the surgery, I would have a physical therapist to help me recover who I trusted, who knew me, had a lot of experience with me, and sure enough, everything went fine. And today I'm absolutely pain-free in this shoulder. I am not aware that there is anything in there. It doesn't feel any different from the one I was born with. And I find it quite remarkable, actually. But before embarking on this, not only did I have a good physical therapist, I did a lot of research on the internet, and there's a lot of stuff there that illustrates how the state of the art has advanced over the years. And it's not just with the surgery, it's with the pain management during the surgery, as Dr. Kelly referred to, with the nerve block, so you wake up pain-free. Now that's a pretty good thing to look forward to, as opposed to 20 years ago when I had rotator cuff surgery and woke up in terrible pain. And going into this early on, I asked Dr. Kelly, well, is this going to be more painful or less painful than my rotator cuff surgery was 20 years ago? And he offered a fairly conservative assessment that, well, this might be somewhat more painful because it is much more complicated and there's a lot of stuff that has to be done. And if you have the stomach to watch the videos of it on the internet, I just recommend that you pass on that. You don't really, you don't like to see sausage being made, and you don't really like to see how you get to this point. I think it's incredible that they do, given all the nerves, the blood vessels, everything that is in between your skin and that joint. But getting there, knowing that with the new pain management philosophy, both during and after the surgery, where they give you a little button to press, which you're supposed to press whenever you're in pain. Through an IV, you get a morphine drip or some other kind of pain reliever. And at first, the nurses chided me for not using it enough. Well, I was being stoic because that's what I was trained to do. And I had to be stoic for a decade or more living with shoulder pain. What did shoulder pain do to me? It made me more sedentary. I gained weight. I became unhappy with my life. I became depressed. And depression has many causes, and now people are much more comfortable talking about it and treating it. But being in constant pain actually is a depressing experience. Just the decision to go forward with the surgery, knowing what the state of the art had advanced to, I felt a little bit like an astronaut. They've put people up in the space shuttle before, and I felt like I was following in the steps of hundreds and thousands of people who had gone through this evolution in the technology. So when I woke up, not only was I not in pain, I didn't have to worry about how long the pain would last because there wasn't any pain. One of the worst things about pain is you wonder if it'll go away, kind of like an earthquake. It starts shaking and your big worry is when will it stop? Well, the pain doesn't stop if it's there, but it does if you don't feel it in the first place. And that, both in the hospital, I was in the hospital for 3 nights. I had proactive pain management, which has been shown to achieve quicker recovery and better outcomes. And I was off pain management, most pain medications, within a matter of weeks. And I know you're not supposed to drive till you're 6 weeks out, but I did. I have to confess, I used my left hand and I had to reach over to the center console to change the automatic transmission. But I didn't go on a road trip because you don't want to be in a situation where you have to react to an emergency or something like that. Well, fast forward to where we are now. I've had several incidents along the way in the last month or so where I've unexpectedly had to suddenly put weight or stress on this shoulder. I was getting off a bus and I sort of tripped on the stairs and had to grab the rail that was attached to the door to steady myself, and it pulled my shoulder way back like that. I was scared to death that within a matter of seconds I would feel excruciating agony. I felt nothing. I was amazed. And then I was looking at a new building the other day, and I slipped and fell and broke my fall by landing on this hand. And again, I wound up not feeling any pain. My knee's a little sore from the fall, but not my hand or my arm or my shoulder. What is good about this is that it is empowering. It gives you an opportunity to make a decision about your life, whether it's good enough or not, whether you're prepared to live with this for the rest of your life, or do you want to take some control of your life and maybe do something better with it. And I came out of the surgery and the recovery process more convinced, less depressed, more functional, happier to be around, nicer to get along with, almost anything you would care to say about it. So I'm unabashed and uncompensated, I might add. But I actually I am compensated in the form of avoided pain. Avoided pain is worth a lot more than pain. So I am a classic case now of pain avoidance. And I highly recommend that it seriously be considered if your doctors feel that it's medically indicated. One other thing about Dr. Kelly's program, he mentioned the fellows who work here and learn more about the field and the state of the art. But he told me at one point, the interchange actually works both ways. People new to this process who are surgeons training to be shoulder specialists often think of new ideas that they're not afraid to share with people like Dr. Kelly. So that's why the technology keeps moving forward on a continuous basis, is because this is a teaching hospital. People are here to learn and share what they learn and be creative and so forth. So if anybody, I don't think we have a Q&A on this, but
We do at the end, Chip.
okay, so I'm not going to leave the room. I'll hang around for a little while. But I think that's a summary of how I felt about the whole thing.
Thank you, Chip.
Okay? Good.
I think that was a whole lot more interesting than what I said.